Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. Excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. Today's guest is really ripped from the headlines. The fires in California. Again, your job is challenging, and this is an example of that. We're excited to have Ray Lowe, SVP and CIO at AltaMed. Welcome, Ray.
John, thank you. Thank you for letting us share the story of what's happening in the community in Los Angeles, in particular, what's been affected by the Eaton Canyon fire that just burned through over 800 structures in the upper Pasadena area. I mean, AltaMed, we're a Medicaid provider that really goes through a number of working class communities that have been directly affected, that may have been burnt, folks that are homeless. And, we're also rallying to support the relief efforts at the Pasadena Convention Center. So it's a very interesting time right now.
Yeah. No, and I appreciate you taking a little time to talk with us to share. So I imagine so many in the health IT community are wondering how you're doing, how organizations like you are doing. You're an LA native. Give us an update. What's it like in Southern California right now, not just from a healthcare perspective, but a mix of the healthcare and just generally as a community member?
Yeah, I've been in LA my whole life, and I think it's just shock, right? It's shock and awe. The fires didn't discriminate. Pacific Palisades is one of the wealthiest areas in Los Angeles. And
Yeah.
then you go over to Eaton Canyon, which is more working class of a neighborhood. So fire doesn't discriminate. And, things that areas you've grown up with, I worked at Kaiser, it's just south of Pasadena, and we have a clinic that's in Pasadena that was actually destroyed during the fire on the first night. And, you go to the coastal side of Pacific Palisades, and Tom Hanks and those folks losing these multi-million-dollar mansions, these iconic properties are out there. The city has never seen such devastation. And as these continued spot fires come up in the canyons, more people are evacuating. It's very scary. I think the other part of it, it's great to see people opening up, willing to help other folks out there, helping them to shelter. But
Yeah.
a catastrophe like this, it's not over in a week, right? The news will move on, but the folks that are impacted, it's months, it's years, right? If you're displaced and you have nowhere to live, sure, Airbnb and hotels dropping discount rates for a week or so, but you have a long-term problem that you need to address and you need to solve.
Yeah, no, I mean, we've seen that firsthand in an interesting way because obviously I live in Las Vegas and we've had people move here that their house burned down and they have to move to Vegas for a year or 2 years while it rebuilds. So I can appreciate that sentiment in a big way. Talk to me about some of the impacts to healthcare organizations that you're experiencing, that you're hearing about from others. Obviously, it's so sad you lost an entire clinic. Sounds like everyone was out though, so at least the people were safe. But what are some of the impacts you're hearing from healthcare organizations?
Yeah, if you put a time marker on it, today it's Friday morning at about 10 o'clock in California. You put about a 3 o'clock or 4 o'clock time marker on Tuesday. That's just a few days ago, right? In terms of how events have unfolded. What I've heard from other systems is they were looking to how do we evacuate if they are in a fire threat zone.
Yeah.
Those contingency plannings, where are you going to move your patients to? We all go through incident response. What is the status of our facilities? Are they safe? Are they in evacuation? What is happening with our people? What is happening with our staff? What is happening with our patients? So what we have to do is, again, go through those wellness checks. And then we have about 1,000 appointments a day. And we had to evaluate those and reach out to those patients. We moved to shift many of those to be tele visits versus in-person visits. What they didn't talk about in the news is all the power outages. I live about 5 miles south of the Santa Monica evacuation line. And then we had a total blackout for about 14 hours. And there were again, it doesn't hit the news, transponders are sparking. And there was a little brush fire that popped up, 4 blocks away from me here that was put out. But, it's it's very, very disconcerting. But
Yeah, hard to do telehealth when you don't have power too, right? So you almost have to, evaluate which patients could even do telehealth, and if you don't have a house, you can't do telehealth either. So yeah, that's amazing.
yeah, yeah, absolutely.
Yeah, well, and I mean, to your point, there is this whole trickle down impact that we're seeing. Like even in Vegas, we had our gas line from California cut off because of fear of the fires, and so the question is there going to be a gas run? And we're gonna, so it's amazing how wide the impact is. What happens when a facility is, for lack of a better term, just gone, right? You sent some pictures. We'll include them in the article if people want to check them out, and you're okay with that. But what's the process? What can we learn from the tragedy of losing your clinic?
Yeah, I mean, so again, this is all about incident response, and I'll tell you, we all have administrators on call in terms of who is on deck, who is going to call it, who's going to call the crisis around there, and I actually called the CEO on Tuesday at 7 o'clock because you're trying to figure out what's happening. Right? I said we need to go to emergency response. We need to activate our incident command center. We need to go through the process of how we're going to be managing, how we're going to be communicating, how we're evaluating. So, I mean, every health system has that, and it needs to be practiced, right? And sometimes it gets practiced when you're in a real emergency. Other times you are doing it very well. So that could vary from area to area and system to system. But that's a non-negotiable. It's required by Joint Commission as well. But we can always do better in those areas.
Yeah, and it's interesting. That was a question I wondered about. Is this something you've planned for because there's been so many fires in California? I mean, we know fires happen, earthquakes happen in California. Is that something you've kind of prepared for as part of your emergency response, or was this kind of like a little bit of surprise? Maybe it's the depth that maybe you hadn't prepared for.
Yeah. So, again, we're talking about business continuity, disaster recovery, right? So from like an Epic perspective or an Epic shop, and there in your clinics, you also have like your downtime PC, your downtime printers, whether a hospital, ambulatory, it doesn't matter, right? You have that ability to continue that charting for patient,
Mhm.
continuity, right? But when you're looking at facilities, sometimes is it isolated, is it broad, right? How are you diverting? Where are you diverting? How are you communicating? How are you moving folks out, out and about? If I can just, kind of share a story, what's happening in Pasadena at the convention
Yeah,
center.
be
We
great.
have boots on the ground. We have physicians, we have nurses, we have their support staff, behavioral health staff as well. We have PACE programs, which are elder care programs, you know, and if you recall the news, they showed this skilled nurse facility with old elders on gurneys that were being transported there. So they would be in that 600 group from the first night. Yeah, but how do you transport them, right? We have docs that are out there, and other community docs are out there that are triaging patients, saying you need to go to the hospital, right? You don't have your meds, right? Let me call this in for you, right? So there's a lot of separation. Things go when you're as a person told to evacuate. What do you grab? What do you not grab? And obviously, you're going to forget something.
Sure.
Yeah.
Yeah, I mean, we've seen people go back a few times because they forgot something, and even then, they didn't. And it is AltaMed's working with to support the public health services. It's interesting that I think you said they're evacuating to Pasadena to the convention center. Do you have to essentially set up a practice in the convention center, or how are you kind of approaching supporting public health services?
Yeah, so that's a great question. So the LA County Department of Emergency Services reached out to AltaMed as well as the city of Pasadena for us, to help them. And in an emergency crisis, it's always going to be chaotic, right? Who's on first? How are you setting up? Come here. The services aren't identified. Things start trickling in. How do you help and how do you serve patients on there? So the clinical teams are out there. They're doing triaging again, where, how. But there's more, that we're finding. There were so many lessons we learned during COVID, and we were doing COVID testing in there. And so if you have to prescribed medications, right? You forgot your high blood pressure med, you forgot your diabetes med, COPD, so many things that are lost out there, and you can't really order those without doing some type of an express lane that's going to connect you into your pharmacy ordering system, right? So we're
Yeah, not to mention, do you know what that was prescribed to them? And the patient often doesn't know. So then
correct.
you're hoping, you can get it from some exchange, I imagine.
Correct, right? And hopefully, you can find it, or you can query it, or you can do it. But the thing, what's important is that we address the patient needs, where they are, and the clinical teams are out there assessing, and they could be dispensing out to 24-hour CVS, have things, delivered. But there's a lot of folks. I understand there's over 3,000 people alone in the Pasadena Convention Center, of all different ages, well, unwell, et cetera. So it's quite a challenge.
Interesting. And you talked a lot about, rescheduling patients for telehealth or diverting them to other clinics. What were some of the tools that have been key to you being able to do that? It's because, it is a complex thing. Can they even be diverted? Can they make it to the other clinic if you divert them? Or were they so close and they rode a bus? Or, I mean, there's so many aspects
Right.
to that diversion. What were some of the keys that you've seen, and tools that you've used for that?
Yeah. So again, looking at Epic Cadence, right, and the tools on there, we reviewed every appointment for every clinic
Okay.
within there. We now Orange County was not under fire alert,
Okay.
so we were able to kind of geo isolate. We had about 8 clinics that are in that sphere of the Eaton Canyon fire. So we looked at what was happening in there. Every patient was contacted. Every patient was offered a virtual visit alternative. We shifted as many as possible to that. So in order to do it, we all do telehealth, right? But if we're now setting up that virtual telehealth hub, there are nurses that do room us and televideo visits. So in our training rooms, we set up virtual nursing areas so that those patients could be properly roomed, so that the doctor could do the televideo visit versus, it might have been done in a more traditional clinic setting.
Sure.
Yeah, so that kind of that continuity, setting that up, and doing it in a different fashion, but ensuring that the patient's taken care of. And then the other part of it is, it's all hands on deck, right?
Yeah.
It's providing the care, meeting the patients where they're at, administrative, doctors, et cetera. They're all, back in the clinic, providing where we can, doing televideo video visits, et cetera.
That's awesome. I mean, it's interesting. My stepdaughter was supposed to go there for a concert that obviously was canceled, and when they were evaluating going, they said, "Hey, you're not going to want to come. They're closing random streets. You can't
Yeah.
even get around. If you have a doctor's appointment, you may not be able to get there because the street's closed because there's a fire line or whatever it might be." So that definitely is a complex situation. We'll have time to analyze this after the tragedy, as we get past it. But is there something you suggest to other healthcare organizations to make sure they're prepared if a tragedy like this or others hits their community?
Yeah, again, it's just our business continuity, incident command response. It needs to be well defined. As IT leaders, we understand the systems, we understand the communications, right? We need to go further across to help our operational partners really instantiate, this is what we need to do. This is the best practice. An interesting thing is we use for broadcast messaging. The question came up: can you do it in Spanish? I'm like, because we have a lot of Spanish speaking
Sure.
employees. I'm like, right. And I go, yeah, we did. Right. And so we did that. We never did it before, which is kind of interesting. So the tools that we're using, right, how flexible are they? I think as leaders as well, we need to anticipate the needs. So, fundamental things such as, Wi-Fi connectivity in an area that doesn't have good connectivity. In order for us to triage, let's get those computers, those laptops, those iPads, right? Let's build out those express lanes so that we can address the needs in the community, because healthcare is not just tied to our medical centers and our clinics. It's really tied out to the communities. And when these events happen, we have to go out in the community. That's why we're in this business, right? For the health and well-being for all.
Yeah. And to your point, it's all about good communication. Many people probably wondering, is the clinic even open if I go to my appointment or not? Even if they're just close to an affected area, it's a challenging situation. Anything, the health ID community can do to support you and your organization and your community? Any thoughts? I mean, it's always, thoughts and prayers aren't enough, right? Is there anything else you'd suggest to people, that may be watching this and wondering what they could do to help?
Well, I'll tell you what I love about the community is there's a group here of CIOs in Southern California, so we've been in contact. Craig and over at Cedars and TJ at the USC and other folks. So we've been sharing information, which is fabulous. I think the other thing which was really heartwarming was really our vendor supplier community. Sumit Rana at Epic, reached out to me and texted and say, what can we do? And obviously, they really helped us a lot of cadence type of evaluations and changes that we needed to have on the fly. He may not have been aware of it, but like Epic just stepped up. We need to do this. We're going to help you through it. The folks at Chevrolet over at a bridge was fabulous, reached out as well, and many of my contracting terms. So it's great to know that you're not in it alone, right? And I think it really shows you, the ecosystem, the extensions of our teams, and how we need to leverage and help each other.
Yeah. Well, Ray, I appreciate you taking a few minutes to talk with us. I know you're busy organizing all this and, helping your organization, but, I appreciate you being able to give an update for those in the healthcare IT community that probably are wondering what's going on and how are things going and what can they learn from it. So thanks for taking time to talk with us, and thanks everyone for watching and listening. If you want to find more healthcare IT content like this, you can check it out on healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting application. Thanks, Ray.
Thanks, John.